but welcome. I see a few Brickstone faces here as well, so it's nice to have a mixed crowd today. Couple updates, just a reminder, Chantel and Shireen start today. They're in orientation. Chantel will actually be in the building tomorrow and Thursday, working with Megan a little bit, and then Shireen is going to be working Saturday mornings from 8 to noon. So we'll have elder advocate coverage on Saturdays for the next 5 or 6 months, and then they'll be working a little bit in the evenings and afternoons as well. So we'll try to get them to this meeting. Most everybody's familiar with Chantel unless you've moved in here in the last 2.5 to 3 years. So we'll try to get them here for that. As a reminder, they are filling in per diem for Hannah while she is out on maternity leave for the next 5 to 6 months. So Hannah and baby are doing great. And then another reminder, David Watkins starts 2 weeks from tomorrow, the day after Labor Day. He is our new Executive Director of Dining Services, and we're already starting to move forward a little bit with the restaurant plans for operations of the restaurant open to the public at Brickstone. So just a reminder on that. Other than that, yes, sir.
Tony, you said the executive director, is that replacing Debbie or is it somebody different? I'm just confused.
So it's somebody different. So why executive director means it's above a director position. So he actually is above Essence. It's a fully new created position. Essence reports to him, he's going to be overseeing dining services at Meadows and Brickstone. And like the big difference now is we're creating the Meadows or a Brickstone dining services program, which we didn't have before. So previously Brickstone was catered and everything was done through our program here. It's just too big for one department to run, and then running a restaurant open to the public, it didn't make sense for our dining program here to run a restaurant open to the public. So he is going to be, his title is Executive Director of Dining Services because he's going to oversee both locations. But Essence's role, responsibilities, and her direct reports do not change. The only thing that changes is she's reporting to him. And she worked with him for 4.5 years at the Episcopal home in the same structure. He was the executive director at the Episcopal home, and she was the director of one of the locations he oversaw. So they're very, very familiar with each other. Essence is in Disney this week, so she is enjoying her last couple of weeks of summer. I'm sure, I think they left over the weekend, so they're probably in Disney at this point, having a blast. So, but I'm sure she wishes she was here with us.
She might, she's with her mother-in-law.
Oh, yeah, okay. Jody said she might because she's with her mother-in-law. So I did not say that. Yeah, I love my mother-in-law very much if she is listening to this. Yes, my mother-in-law is actually a pharmacist at Strong. Yes. Who's my mother-in-law? I doubt you would know her. We talked about this on Friday at Brickstone's Coffee Hour, but I'm in the process of ordering a sign for the trails. When you get up to if you're walking to Brickstone, there's kind of a T. If you go to the left, you end up on the Highland Trail. If you go to the right, you end up on the Brickstone campus. So we're going to put a sign there that says Highland Trail to the left, and it's going to say Brickstone campus to the right with a little private property underneath the Brickstone campus piece. So I got the proof for that. It's a nice white sign with a white post and a couple other things. And we may just kind of use this format as we go through and label signs and trails and things like that going forward. I don't know if I mentioned it here. I probably did, but our marketing department is working on a new marketing pamphlet that's going to be like a trifold open up map of all of our campus trails. So it would list all the names of the trails, the names of the ponds, and it would also give the distance of the trails for those who love to walk. So it kind of also gives the distance like around Brickstone Circle, which is a perfect circle, and it gives the distance around the Meadows main circle campus. So if you want to walk and track how far you're walking, we're going to have that pamphlet done probably sometime this fall. We've been working on it for a little while, but it's a complete redesign of a piece of paper. So we have that coming as well. You and Morgan will chat about it. She won't be here next week, but the Briarwood parking lot is being done next week. So notifications will be going out this week about that. And we're not just sealing and striping the Briarwood parking lot, we're actually ripping up the old top coat of the asphalt and layering a new top coat of the asphalt. We are luckily able to add in 5 or 6 parking spaces. You may have noticed they ripped up this little shrubbery of trees and bushes and things like that. That's where we're gonna put 5 or 6 parking spaces right there. And then they're actually also, if you're wondering what they're trenching out there with the tractor, we're running electrical to that side of the grassy area. So whenever we do the festivals and markets, we have extension cords ran all over the place. So we kind of took the opportunity to run electrical out there. So we're gonna have a couple poles with outlets on them. And they're actually gonna run a data line out there. Data line is for our Wi-Fi, so we can get Wi-Fi on the far side of the parking lot for all of our tablets and devices and things like that. So Grounds is out there working hard, getting that situated before the work comes next week on the parking lot. They're hoping to have the Briarwood parking lot completely done next week, and then we just have a ton of other projects going on for the next month or so. So when it's all said and done, all of the campus is going to be sealed and striped, and 2 or 3 different locations are getting completely new asphalt. So it'll be a nice little refresh for us. Okay, yes.
What about water for people who like to garden outside? Because some wings, not mine, but the next one over, they do not have access to the water.
Comment was, what about water spigots? We, at this time, have no intentions of, we have no plans. This is kind of, water spigots would be completely separate from the paving project we're working on. Our grounds crew has done the best they can with running long extension cords and hoses and getting them to places that don't have water for those. But we don't have a plan right now to go through the entire campus or run new water lines and spigots to the outside of the campus. So if you have an issue or concern, you can call Jody. Jody will send them out to take a look at it. See if there's easy access to drop a spigot near your area from the inside of the building. That's where the water lines come from. And if there's not, they generally will go find the closest spigot and put a splitter on it and send a hose over towards the area, which we've done a lot of times all over the campus. So the building wasn't designed for residents to have personal water. It was designed with enough spigots spread around for the grounds crew to have access to water lines. But obviously, we've had some residents over the years that we had to talk to that were claiming that other residents were using their spigot. Nobody owns a spigot here. We own all the spigots, and they're all community spigots. So whether it's in front of your apartment or not, it's a community spigot. So, but the building wasn't designed for every area to have a spigot. It was designed for enough spigots for grounds to have access to water on the outside. So, but we do our best to accommodate in those situations. You guys share it. There you go. Sharing is caring. That's what we tell the kindergartners at the school. Other questions for me? Let's let Morgan go. Morgan doesn't like to be put on the spot or embarrassed, so we're going to do both. Morgan is working a half day today and a half day tomorrow, and then she is off until September 2nd because she is going to come back to us Morgan Brownyard, not Morgan Holsapple. So big congratulations to Morgan and her wedding week. And with that, we'll let her go over her updates.
Thank you. Okay, so I am off starting on Wednesday, but for the paving project, we'll have that memo out to you soon, today or tomorrow. And that goes from Monday, August 25th So the Briarwood Parkers in the parking lot, if you could start moving your car by Friday, the 22nd, this Friday, if you could have your car out of there, that would be great. We would love to start coning the spots off starting on Friday, I believe. Like shaking his head, thank you. And then over the weekend, we will continue to block the spots off. So you'll have to park either on the roadway or you can sneak around to the back of Briarwood where the employees usually park and then walk through the art gallery to get to Briarwood. If you need help with that, just let us know and we can explain it to you and direct you. So that will be Monday, the 25th through Labor Day. So the parking lot will be back open on September 2nd, okay? So a nice long week to make sure everything's done and situated. Questions on that? The next paving project is not until, oh, I'm sorry, Alice.
I'm just wondering, had a gentleman asked me how to get to the barber, so will there be signs in here soon?
Signs to the barber shop?
All through, just to direct us. in-
Oh, yes, we talked about this a little bit last week. Tony and I met with the sign people last week and we have them working on the signs and there's gonna be signs galore.
Sorry, I didn't mean to cut you off. So there won't be signs in Chestnut Court saying barber this way. Because how signage works is you only put signs in the building you're in. So there'll be signs directing you to Briarwood. And then once you get to Briarwood, there's signs that say salon this way. So you don't ever put barber salon this way in a building where it's not. Does that make sense? Like you won't see dining room signs here or cafe signs in Briarwood. You'll see signs getting you to Briarwood or getting you to Chestnut Court. Then you follow the signs from there. If we did every sign for everything, we would have cafe, pool, fitness room, lobby, Briarwood lobby, Chestnut Court lobby, dining room, Hawthorne dining. You see that it's just too big. So you go from building to building. But we're going extensively through the Chestnut Court building with signs directing you to Briarwood and the art gallery and the medical suites and the cafe in Briarwood. And then once you get to Briarwood, you shift over and follow the signs from there to the salon, which really is just from the lobby at Point Salon to the left. There's going to be pool, again, same thing. It's going to shift you to Chestnut Court. And then when you get in Chestnut Court, you start following the pool signs to the pool. Okay? Yep.
Okay, I was gonna say that the next paving project after the Briarwood parking lot will be the employee lot, I believe. And that is not until the second week of September. So you will get another memo when I get back the first week of September with the next paving project. So just so you know, that's upcoming. What's the employee lot? The employee parking lot is the parking lot behind Briarwood. So when you pull into the main entrance, you turn left, you go past Hawthorne, past a few garages, and there's a big parking lot to the right in there. Okay, and then you can go up the sidewalk and it brings you to the walkway. So then you can either go to Chestnut Court or Briarwood.
So if you have your car in a garage there, you're going to need to remove it.
Right,
Yeah.
we can cross that bridge about the cars in the garages when we get there. How about that? We'll cross that bridge in September. Okay. The other announcement is for Kim. Tomorrow they have 2 p.m. entertainment. Nope. 3 p.m. entertainment in Briarwood, right, Kim? Yeah, in Briarwood tomorrow. It's a new person. Monk Rowe is an accomplished keyboardist, saxophonist, and vocalist. His lengthy list of memorized tunes includes early rock and roll, romantic ballads, sing-alongs, and classic country. He is adept at taking requests and likes to include a bit of music trivia and a Name That Tune challenge as part of his upbeat performances. Monk is a native of Irondequoit and has returned to Rochester after many years of professional work in Utica and Hamlin College. And he's looking forward to meeting you all. That's tomorrow at 3 o'clock in Briarwood, a new entertainer for us. So hopefully it's good. Should be wonderful, yeah.
Yep.
Any questions for me or about that? Okay, thank you.
Another update I just received a reminder on my voicemail. We're going to be playing musical chairs with pianos this week. So You may notice we're finally going to be removing the old baby grand piano from the Brickstone Winter Garden and moving it over to the Briarwood multipurpose room. I had them all professionally inspected by some renowned pianist out of Canandaigua who runs a piano repair shop. And the Brickstone baby grand piano is a much nicer piano than we have in the Briarwood multipurpose room. He described it as the brands of the pianos being a BMW versus a Honda Civic. No offense to anybody who has a Honda Civic in here. But that's how he described them. So we are going to shift. We're going to have two pianos in Briarwood for a little while. I'm going to try to sell the current baby grand piano in Briarwood just to kind of offset some of the money of moving the pianos around. But it's Bergman is the Briarwood one, and I can't remember the name of the one at Brickstone, but if anybody's familiar with Brickstones, it's a higher end brand piano. So the baby grand from Brickstone is being moved over here. I'm sure all the performers will be happy because they have let us know over the years that the Briarwood piano is not the nicest. So, but you may just see that's happening Tuesday between like 12 and 2. There'll be some work in the Winter Garden, and then they'll be shifting over here and setting that piano up here in the foyer. And then we may have some people coming and going to look at the Briarwood current piano before that one is sold off, or if we can't sell it, I'll eventually donate it, but don't tell anybody that because we're gonna obviously try to sell it.
I do have one more thing. I do have one more thing. I don't know if anyone noticed all of the art in the art gallery walkway. It's beautiful. It looks so professional. I'm so happy with it. Two things. The first thing is the lights are on switches by the door, but they are also, the track lights are on a timer. So if you try to turn the switch on for the track lights and they don't come on, it's because they're also on a timer. They will come on, okay? If you walk through and they're off in the middle of the day, check the switch and flip the switch. We'll be on that as staff, but, or you could just leave the switches alone. That would probably be the best thing. But they are on a timer. I had a couple of people ask me about that. So the art walk looks beautiful. Big thank you to Karen Hall and Dee and Dwayne Rasmussen who helped out the rec team last week. It's still in progress, so they're still doing some more finishing details. And then Kim said that the grand opening with wine and cheese will be the week of September 8th, and that will be in What's Happening.
Yes, sir.
Is the art walk for those of us from the other side?
Yeah. So I'm going to say this right here with everybody in the room. I don't want to refer to it as the art walk. Let's call it. It's the walkway between Briarwood and Chestnut Court. I don't know where that name's coming from all of a sudden. It's the art gallery and the walkway. We call it the walk. I think they're combining art gallery and walkway. So it's the walkway between Briarwood and Chestnut Court. So everyone, let's drill it in our heads. It's the art gallery, which is in the walkway between Briarwood and Chestnut Court. So, and I will talk with our team about that as well. Art walk is just kind of a funny name. It's not really a thing. So we really push art gallery. All the signage we're having says art gallery. So it is our art gallery. It's between Briarwood and Chestnut Court. So it's the walkway between. We've always referred to it as the walkway. And that's the building it's in. It's a really nice feature now as you're kind of going through. It's filled with windows. It's bright, and it's covered. There's so much more space to add artwork now because we took down all the curtains, the blinds, we are re-adding the donor plaque, but it's going to be a really nice modern plaque that's going to be right inside. If you're coming from the back entrance, it's going to be right inside on the right. So a new plaque will be hung up there with all the names. For those who don't know, the art gallery walkway was donated and built by residents back in 2004. So for those who really have lived here a long time, you used to have to walk outside to get to Briarwood or Chestnut Court from one building or the other. So our poor cafe staff had to lug their carts through the snow in the winter to get from the Briarwood kitchen over here. So our residents graciously, plus some staff, donated money and built that walkway back in 2004. Any other questions? I don't want to go into too much depth about anything else. Megan, do you have anything to share?
Hello, good morning. Thank you to everybody that came out today. I know we have our congressman in about 10 minutes, so I'll just make this really fast. I only have one thing anyway, so. On August 20th, that's on Wednesday, there's gonna be Scammo or Scam Bingo through Lifespan's Scam Prevention. It's a game very similar to bingo in which participants' knowledge of scams and fraud is tested, definitions are read, and answers are called out. Cover 5 spaces in a row, shout scammo. All are encouraged to join in on the fun and learning. And again, that's August 20th from 1 to 2 here in Chestnut Court Parks Room. If you have any questions for me, please let me know. So yeah, it should be fun. We had a fun time over at Brickstone when we did name that scam, so it should be a fun event. All right, I'm gonna hand it back over to Tony. Have a great day, everybody.
Megan reminded me, it was asked on Friday. I know everybody is probably getting their text messages and their emails and their Wegmans app notifications that flu shots are now available at Wegmans. We will be doing flu clinics here, obviously, and COVID clinics, but it's just too early. I personally don't believe it's smart to be getting your flu shot in the middle of August. So we will be doing that more end of September, first week of October, which is when we generally always do them. And that's really when it's recommended by doctors and even Wegmans. We work with the pharmacy manager at Wegmans. He recommends for this population to wait as well. But obviously there's some people that jump on it right away. So they're going to get the early group if they can, but we're going to hold off on that. And then the question was, are we doing COVID booster clinics as well? That'll be tied in to the flu clinic like it's been the last couple of times. So we'll never do like a standalone COVID clinic again. It'll always be tied into the flu clinics when we do those in the fall at all the neighborhoods. Okay. If there's not any more questions, I think Morgan and I are we got to put the podium up, switch out to their computer. And so you all got about a 5 or 6 minute break, and then we'll be back with Congressman Morelle. Thank you. Test 1, 2, testing, testing. Where's this go? Around the corner.
Oh, yeah.
So we'll probably have to have somebody run around with questions later.
Oh,
Yeah,
yeah.
sorry, I guess I've never said this to you guys in person. I don't like the name. Yeah, okay.
I think the top time to finally starting to work.
I wanted to push the new polls, before all the new polls and stuff, so. All right.
That's going pretty well.
Yeah. Thank you.
That's all right.
More chairs.
Yes, I do.
All right. You ready to get started again? So, we ready to get started? So hard to get this group their attention twice. Thank you again
We had such a big crowd today. I thought you all came here to see me today, but as we said, I really to see our special guest. So please welcome U.S. Congressman Joe Morelle, representing New York. Representing New York's 25th Congressional District, which includes Monroe County and parts of neighboring Ontario County. Congressman Morelle was previously elected to the Monroe County Legislature, as well as New York State's Assembly, where he served as Majority Leader from 2013 to 2018. Congressman Morelle is a lifetime resident of New York, residing in Irondequoit, New York. So please have him come up, and thank you for being here.
Good morning. A great crowd. If I knew how to use my cell phone, I'd take a picture of all of you. But actually, I just gave it to Eric over here. So I wouldn't be distracted with all these texts that come in. But I don't know about anybody else. Tony, I came to see you. So I'm happy to be here at St. John's. Such a wonderful place to be. And so appreciative of all of you coming out. I hope you're having a great Monday. Happy Monday. I went to the gym this morning, so I have 5,000 steps in already. I know, right? That's pretty good. 5,700. That's pretty good. I'm feeling pretty proud of myself. But if you don't do it on Monday morning, I feel like the rest of the week I'm like, so anyway, I'm feeling good, and I was really happy and excited to see that I was going to spend some time with you this morning here, and I'm grateful. I want to talk a little bit about what's going on in Washington. I'm so happy August, but they call Washington the swamp. People refer to it as the swamp for many different reasons, but the first reason is it was actually built on a swamp. I mean, I assume most of you know this, but not everyone does. And people will say, why is Congress never in session in August in Washington? I said, well, if you've been in Washington in August, you know why. It's about 100 degrees and it's humid. So I think probably since the House of Representatives started meeting in Washington, because the first capital of the United States, once we formed the new Constitution and George Washington was elected, he took his oath of office in New York City, Federal Hall, which if you haven't been there, you should go visit. It's amazing. And then, of course, they moved the capital to Philadelphia, and Washington served there. He's the only U.S. president not to serve in Washington, D.C. Sort of interesting. John Adams is the first president. As a part of a compromise, they moved it to Washington, but it was literally built on a swamp. And so I'll bet since the beginnings of the move to Washington, the House has not been in session in August, the only month that we're not in session. And honestly, I'm so happy to be home. I get to visit with people like you. I get to sleep in my own bed. I get to see my wife occasionally. Although I think by the end of August, she's happy to have me go back to Washington. I should answer that. So, but I wanted to talk about a couple of things that have been in the news that relate to Social Security and Medicare in particular, a little bit about Medicaid as well, and then talk a little bit about some concerns about the growing incidents of scams involving and targeting people. Sort of just some tips that we work with Lifespan and we work with others to try to just give the word to people to be careful because the numbers are really troubling. And then, frankly, the best part of this will be if you have any questions, I'd love to hear what's on your mind. So we're going to do this. Before I do that, I want to introduce my team because if you ever have any issues, please call our local office. We have some really, really great people who work on constituent services. I tell them for all the sort of attention that Washington gets when people have problems home and they need answers to questions, they are clearly the most important people in the world to our constituents. So I want to introduce Toy Smith, who's the head of constituent services in our office. John Polito, who has been with me from the beginning, and actually John served with my dear friend Louise Slaughter in her office. And John does a number of things. We keep promoting him because he's so talented. But he's going to be running, one of his primary jobs today, though, is running this so it works, so that I'm designing technologically. And Eric Rose, who sits and helps greet people at the front desk. So we have just a wonderful group of people, and I often say, I don't really have any superpowers except getting really extraordinary people to be able to be willing to come and work with us. So I'm really grateful for them. So I will say this is a frightening time in many ways. And I would be less than candid if I said that I don't spend a lot of nights tossing and turning in bed. One of the first things I do in the morning before I go to the gym is check the headlines and read, all the news that I need to read in order to do my job. And I will say the headlines some mornings are so discouraging that I feel like going back to bed instead of going to the gym. Because these are difficult times, and many of the things, and I certainly don't want to be partisan, so I try not to be. I work with a lot of great Republicans who are friends, many people in this community, but many people in Washington. Before that, during my service in Albany, I worked with many Republicans to try to find common ground and to try, no one is always right. My wife reminds me this often that I'm almost never right. But the truth is that good ideas come from everywhere. And so trying to find common ground, I think I probably wrote 300 different laws maybe during my time in the state legislature. And every single one of them had a Republican lead in the state Senate. So I've worked with them. So this isn't Republican or Democratic, but I will say this about the current occupant of the White House is Democrats and Republicans. And before that, Whigs, Federalists, presidents going back to the beginning of the Republic adhere to certain norms and certain standards and certain types of behavior. And in many ways, the thing that I find most challenging about this moment is those norms are never adhered to. I can't imagine a president of the United States, I'm a member of Congress, I would never call another human being scum. I would never demean any other person. I might disagree with them. But I think this is really cracking away at the foundation of American democracy when we have someone who's leading, who appears to have so little regard for half the public. So anyway, and my father, who didn't finish high school, was probably one of the wisest people I've ever met, and rarely preached to me or preached to his other kids about how we should behave. He kind of modeled behavior. He just followed what people do. But he would always say to me, just treat people like you want them to treat you. And if you do that, which is the golden rule, he didn't invent it. But I try to remember that whenever I engage with people. How would we like in a conversation? How would we like one another to respond? How would we like the person, even if it's an argument, how would you like someone to treat you? And I think that's what we're missing right now. And I think too many children, and it is important, our children, grandchildren, hopefully great-grandchildren, they really do watch how adults behave. So when people think, well, they don't care about it, they do. And they're watching. And so if they think some of the most important people in the country are treating folks that way, why is it not okay for them to do the same thing? So anyway, but so with that in mind, wanted to talk a little first about Social Security. So just last week, we celebrated the 90th anniversary of the signing of the Social Security Act by Franklin Roosevelt. And when you think about it, up until that time in the 1930s, so many people had to keep working to the end of their lives if they could, because there was literally no way for them to continue to earn income. And Roosevelt and others came up with the idea that we should have a national pension system. Now, it wasn't intended, it's probably still not intended to be the only means of income security, but it was a foundation. And for 90 years, it has existed. And, now there are real threats to it. Now, I will say there haven't been proposals yet to reduce benefits, but the president just laid off 7,000 Social Security office workers. So, Toy, who does in our office, among the other things that she does Social Security. So when people call with questions, and people need to get through to someone, if they're calling us, they're already frustrated because they haven't been able to get an answer from the Social Security office. And what I'm afraid is this is going to affect benefits. I'm also afraid that unless we dramatically think about the program itself and how it is structured, that in relatively short order, the next 7 to 10 years, we're gonna have challenges paying off benefits. So there's a number of things we have to do, and I'm very, very worried about the program. And I think there's some things that we have to do. I'm gonna continue to fight. I think this, and by the way, when people say that Social Security is an entitlement, we need to privatize it, we need to do this or do that, this isn't an entitlement. Everyone who's ever worked, literally from the time, I asked people this, but you remember Star Markets? Anybody remember Star Markets? Well, I was the worst bag boy in the history of Star Markets, I'm pretty sure. I was pretty bad. So much that they moved me to marking. Remember, they had to mark every box with a like gun, and I couldn't do that very well. They put me in produce. They put me all over. But whatever they were paying me, which was I think about $1.25 an hour. I'm not even sure I was worth that. But from the time I started doing that, I was paying FICA. Everyone here who started, whatever your job was through your entire career, or if you didn't work and you worked in the home and you had a spouse who worked, they paid Social Security. This isn't an entitlement. These are the premiums that you've been paying your whole life, like you do with life insurance or like you do with automobile insurance. You pay, and then when you have a claim, which is when you retire, when you reach age 62 or 66, now whatever your retirement age is, you get the benefit of that. That's how it is. So when people say, oh, we can't afford this entitlement anymore, we're not giving it to anybody. We're investing your money and giving it back to you. But what I will say is we're gonna have to make some changes to it, and I will not vote for any reduction in benefits. I'm not voting for an increase in the retirement age. People work long enough. But there are other things that we're gonna need to do because there are more people, thank God, living longer than we expected in 1935. So we're gonna pay those benefits. So a couple of things that we do. One of them, and I do wanna just mention briefly, Social Security 2100 Act, I'm a co-sponsor of. And this would, so the way I think you probably all know this, you pay Social Security tax up to a certain amount of income. Then whatever income you make beyond that, you don't pay Social Security taxes on. And so if you make $1 million a year in income, you pay Social Security taxes only on the first roughly 75,000. It's a little more than that, I think, today. And that's it. You get benefits, but you don't get to pay any more than that. I think that's wrong, frankly. I think at this day and age, if you're making $1 million a year or $5 million a year, you should pay more into Social Security. You'd get a little bit more of a benefit. I'm not opposed to that. But if we're gonna make this a robust system and make sure that it's solvent for as long as the eye can see, and Social Security 2100 Act would do that. It's currently capped at 176.1, so that's the number right now. So I talked about the cuts. These are a couple of other things. I mentioned reducing the number of positions, 12% of all employees. And one of the things that this administration has done is they're firing people before they even find out what those people do. And, you know, I know the myth about, I don't know if any of you ever worked in the public sector. Being a public sector employee is really hard. It's demanding. People expect a lot of you. So look, I just think if people work, no matter what you do, you're probably working hard. I certainly hope so. But the notion that we just go fire people before you even know what they're doing is so scary and so dangerous. I mean, you wouldn't go into a business or any organization. You wouldn't suddenly take over St. John's and say, well, let's fire a third of the staff because we need to bring costs down without knowing whether they're the people who prepare foods or administer medicine or who knows what they do. And that's what they're starting to do, and it's a big problem. So a bill that I sponsor, Keeping Our Field Offices Open Act, would impose a moratorium. You can't fire anybody from Social Security. You rehire as people retire. But let's find out, make sure that we know what everyone's doing before we let them go, and make sure that the service levels are as high as they can be. And then Protect the American Social Security Data Act. This relates also to when DOJ was going through firing people and letting people go. They were also looking at people's privacy and data, and no one should have access to that. That should not be no private companies, no organizations. So that bill protects your data as it should. So we're going to continue to fight to make sure Social Security is safe for everyone, that people shouldn't have to worry. And frankly, given that we're just celebrated the 9th anniversary, it's a good time to redouble our commitment to Social Security. So let me talk about Medicare for a minute, which, by the way, had its 60th anniversary. This is a month of anniversaries. July was the 60th anniversary of President Lyndon Johnson signing the Medicare and Medicaid Act. And again, before that time, not only when you reached a certain age did you worry about your income, you also worried about how would you afford your health care if you're not working. And so Medicare answered that question. So I want to talk, first of all, I guess I'm going to talk about Medicare. We actually made some really important changes to it in the last several years. For instance, we limited the out-of-pocket costs for Medicare recipients on an annual basis to no more than $2,000. Some people are paying $400, $500, $600 for prescription drugs every month. So 2,000 was a limit. We also limited the cost of insulin. So if you're diabetic and you need insulin, many people, again, were paying hundreds of dollars for a drug that, frankly, has not seen significant changes in its composition since it was invented decades ago. So $35 a month will be the out-of-pocket cost if you need an insulin. And then finally, something that I think was long overdue is we gave Medicare the authority to negotiate with big pharmaceutical companies on the price of prescription drugs. We pay more than any industrialized nation in the world. And some of the innovations happen here, but we can't allow people to continue to struggle and to have to make decisions about whether they put food on the table or whether they have their prescription drugs. And, you know, I talk to people who will say, I have 5 prescriptions, but I can't afford all of them. So what I do is I get them one prescription I take, you know, 1/3 the amount of time I'm supposed to, or 1/2 the amount of time. So they're managing their own medicines as though they're a doctor, which is really a bad idea. So we finally got together and said Medicare should negotiate. We're big payers of healthcare, and as such, the federal government could drive a good bargain. So unfortunately, there's some question about whether that's going to continue. I think the new administration doesn't like that. Honestly, I wanted to, and we had legislation, we still have legislation introduced, which would extend that negotiation to everyone in America, whether you're on Medicare or not. So there's no reason for you to have to pay exorbitant prices when the federal government is negotiating with big pharma to be able to bring the cost down for Medicare recipients. So this is something we're going to continue to fight about. Right now, the new bill that President Trump is touting is probably going to cut Medicare reimbursements to doctors and hospitals and nurses, et cetera, by about $500 billion over the next decade. So, you know, it's going to make it harder for people to treat Medicare recipients. $500 billion is not an insignificant amount of money. It wasn't talked about much, but that's one of the ways that we really weaken the Medicare program. So, and that's I make reference to it, that it's a feature of a spending bill that would require a cut in Medicare hospital payments. So now I want to just talk about, for a minute, some bills. I mentioned lowering the drug costs for all Americans that Medicare would negotiate. The second bill, patient access and practice stabilization, would just stop further cuts to reimbursements to doctors and hospitals. So you don't want, when you're on Medicare, to go to see a doctor and realize the doctor's being not compensated enough because they're gonna move people. They're already moving you quickly through. I mean, you spend more than a few minutes with a doctor and they're pushing you out because they're trying to get as many reimbursements as they can. So we have to do that. And then the final is something that should be part of the Medicare program, in my view, which is as we get older, I say with my hearing aids, you know, your vision, your hearing, your dental, they get more costly as you get older. And it definitely should be a feature of the Medicare program. So we want to expand Medicare so it includes those things, which are pretty expensive and also hard to get insurance for. So we're going to continue to work on those things. I want to now turn to Medicaid, which was also passed the same day that Medicare was. They were 2 programs of the federal government, and people confuse them from time to time. So I'll just make this clear. Medicaid is for individuals who are below a certain income level. Medicare is for individuals who are at a certain age or older. You could qualify for both. So if you're below a certain income level and you're over the age of 65, you could be both Medicare and Medicaid eligible. They're called dual eligibility. But so Medicaid is a joint program, unlike Medicare, which is totally a federal program. When Medicaid was created at the same time, we decided to make it a federal and state program. So the state pays part of the Medicaid bill, the federal government pays part of the Medicare bill, Medicaid bill. See, even I'm making mistakes now. Medicaid bill. So when they invented the program, they decided certain states were going to get paid and reimbursed by the federal government at a certain amount. Other states would get reimbursed at a higher amount. So New York, it gets 50 cents on every dollar it spends in Medicaid. So if you're on Medicaid, you go to the doctor and the doctor's bill is $100. The state of New York and the county, but the state functions, the county and state, pay $50. The federal government will send $50. So it's shared payments. If you live in Mississippi and you go to the doctor's office and you have a $100 bill, the state of Mississippi will pay $33, not 50 like New York, 33 at 23, sorry, 23, not 50, but 23. Federal government pays 77 out of every $100. So a lot of states get a lot more Medicaid reimbursement than the state of New York, something we've been fighting to ask the federal government. But, you know, those in the South say, well, why are we giving more money to New York? Well, because we get underpaid, in my view. But now what's happening is Medicaid is under an assault. The administration is cutting about $900 billion over the next decade out of Medicaid patients and Medicaid recipients. And that's over the next 10 years. And that's going to have dramatic impacts on people. Now they do it in a couple different ways. And by the way, in New York, across the country, many people who are in skilled nursing facilities, nursing homes, they're Medicaid eligible. That's how they pay. Even if you go into a nursing home as a private pay patient, someone who's paying for your own care, usually that money runs out and you become Medicaid eligible. And so Medicaid is the largest payer for skilled nursing, for nursing home care in the United States. And it's dramatic. I think 90,000 people in New York are nursing homes, 60,000 of them are on Medicaid. So there's going to be dramatic cuts in the Medicaid program over the next decade, something we fought pretty hard to stop. And you can see what this does. More than 10.3 million people are also not only likely to lose Medicaid, about 15 million Americans are likely to lose health insurance at all of any kind over the next decade, which is really hard to imagine. And people will say to me, well, I'm not on Medicaid and I'm not on Medicare. Why should I care? Well, you should care, first of all, because we should treat every citizen with some dignity and respect and make sure that everybody gets health care. The other reason is because if you think about the healthcare system, think about when you go in an emergency room. And I hope you don't have to, but we all usually end up at some point in an emergency room for ourselves or for a loved one. They don't say when you get there, who's got commercial insurance will take care of you first, or who's on Medicare, or who's on Medicaid. What they say is, who's the sickest? I mean, they're just gonna go through and worry about the people who look like they're having a heart attack or stroke first, and if you broke your leg, you're gonna wait a little bit. And this is gonna destabilize the whole healthcare system. Right now, if you go to the emergency room, and thankfully if you have nothing that's life-threatening, but you broke a bone or you had a fall, you could wait in an emergency room for hours and hours right now. Once this starts to happen and people start losing their health insurance, millions of Americans lose their health insurance, you know what happens? They don't go to a doctor because they can't pay for a doctor. So they'll start with something like a cold and then it gets worse and worse. Eventually, they're going to show up in a hospital because when you're that sick, you're just going to go to the hospital. That's what people do. They go to hospitals. But now there won't be anybody to pay for it. So what will happen is they'll make the emergency rooms far worse, and eventually everybody pays for it because they're required to treat people, whether you have insurance or not. If you're a doctor, if you're a nurse, you take an oath, you have to treat people. So this could have enormous implications. And frankly, right now, you see nursing homes, and we have great ones in Rochester, St. John's, Friendly Home, St. Anne's, the Episcopal Home. Those are all great nursing homes, skilled nursing facilities. They're already struggling to get and hire enough staff to keep their beds open. So right now, people who should be eligible for nursing home care can't get in, so they're in hospitals. And that means people in emergency rooms who should be going into a hospital bed can't because there's someone in that bed waiting to go to a nursing home. This is only gonna get worse and worse and worse. So we're gonna continue to fight to try to roll this back. I am hopeful of this, that a lot of people in Congress who voted for this, one guy voted for it. He represents a district where this is hard to imagine, 67% of the people who live in his district are on Medicaid. And he voted yes for the bill. I gotta know how he's gonna get reelected, but he didn't wanna tell the president no, so he voted for it. But if 2/3 of the people who lived in my district relied on a program that was gonna get cut the way this is gonna get cut and vote yes still for the bill, people should throw me out of office. That's not representing their interests at all. So we're gonna keep fighting back. We're gonna keep pushing. I'm gonna keep voting to make sure that we restore these cuts. We need a better healthcare system. The Affordable Care Act was making great strides. We're at the lowest point in New York's history of uninsured people, the lowest point ever in New York State history. And that's gonna change because people will be getting thrown off Medicaid. People are gonna lose their affordable care benefits. And that's in my mind, a shame. Because as my grandmother used to say, I had a wise grandmother too, she'd say, if you don't have your health, you don't have anything. And so, I mean, I hate to say it more and more, I feel that way. All right, I want to talk about something else, which is preventing scams. And we say at the office, if it sounds too good to be true, it probably is. Couple of things that you just know, just in terms of awareness. The number of Americans that were reported to lose money to scams, and I think this is last year's numbers, $12.5 billion in fraud. 2.6 million fraud cases reported to the Federal Trade Commission. But I have to be honest, a lot of people don't want to acknowledge, even when they know they've been taken advantage of, who aren't filing claims. So that number could be 5, 10 million people who have been victimized, and that's exactly what they are. So a couple of things we just want people to be aware of, and I think most of you are. First of all, the amount of emails now, if you're on email, and most people use email, the amount of email that comes in that's, you want a prize, we want you, you've got a bill with they'll name some organization that doesn't even exist. Or what they're getting really good at is sending you stuff that looks like it's from Social Security or looks like it's from your bank. But banks don't email you for information. They have your information. So it's coming more and more from trusted people. Even sometimes now with artificial intelligence, they can mimic the voice of a grandchild who's calling you and asking you for money. It's really, really, really troubling. So if they're texting you or calling you or emailing you, telling you you've won a prize, unless it's Ed McMahon come back from the grave with Publishers Clearinghouse, and they show up with a big check outside your door. But honestly, don't believe it. If someone's going to give you a prize, you won the lotto, believe me, they'll get in touch with you. But it's not going to be through email, and it's not going to be a text. Delete those, please. I'm begging you, just delete them. Pressuring you to act. This is something they do. Like you've got, 3 hours or 2 hours. If it's something that's legitimate, there's no, now April 15th, you may still have to file your income tax, so don't miss that deadline. But if pressuring you to act, that's not legitimate. Again, they may ask for money via gift card, or wire transaction. That is never legitimate. Never, ever, ever legitimate. So my mother, a few years ago, I think she lost $26,000 on something that looked legitimate. Fortunately, she called her bank, M&T, who immediately caught it before it went through, but she was in danger of losing a lot of money. I said, Mom, how do you do this? I mean, just hit delete. And my wife will show me. look at this text. I said, please delete that before you even inadvertently click on a link. So if there's links, don't do it. And basically, if it's from a trusted person or organization, the American Red Cross, don't click on their link. Go on their website yourself. If you really want to contribute or something, get off, don't go through the link. Just log on yourself. And usually if it's a bank or something, you have passwords. Don't go through the link for that either. I had a letter to Social Security. They were sending out emails. I said to them, you should not do that with a link because they could disguise the next page. You hit the link, it goes to a disguise. They ask you to put in your name and password. Now they have your name and password. So if you get out altogether and you go through whatever browser you use and go to Social Security, go to your bank, then you'll see the legitimate login to it, but don't go through links to do it. And as I said, more and more they're using and they're getting really good at the way it looks. They copy it, they mimic it. Sometimes in the old days they'd use language you could tell it was not someone who didn't speak English very well who had written it. It's getting harder and harder. So here's one thing too that you should do when you're gathered with your family, particularly because they are using grandchildren and their voices to call people and say, Grandma, I need $1,000. You have to wire it to them. I'm in trouble and whatever. You should have a safe word. I know this sounds silly, but it's not. So, pick a safe word. If your safe word is Monopoly or Edsel or whatever word you want to pick, because then if you get a call and you say to your grandchild, well, what's the safe word? They won't know it unless it's legitimately somebody in your family. So everybody in your family should know what that word is so that you can always verify who the person is. So, and that's kind of like a code. And if you're not on the do not call list, please be on the do not call list. It's impossible to stop all these people. I wish some of the people that did scams would put all their considerable talents to doing good things in the world, but that's just not the way to do it. But you should cut off communication. And then if you need to, if you're not sure, call someone who's trusted. Call Lifespan, call the administration here, call our office. We'll let you know. We'll follow up with people to say, is this legitimate? Because it's not, and you can report these scams to the police, to the FBI, to the Federal Trade Commission. And I know people don't love to do this, and I'm guilty of this, but periodically changing your passwords is not a bad idea. I say this about my mother, who passed away in October. I always thought I was her favorite. That's what my brothers and sister always say, you're the favorite. So, but then she named me executor of her estate, so I know I was not her favorite because doing that is not any fun. So I've been looking through scraps of paper to find out what all her passwords are. But she did have different passwords, so I give her credit for that. The last thing you should know is you can monitor your credit to make sure that someone hasn't somehow used your credit card or information. And you can do that by going annually. You can do those three big credit reporting agencies in the United States: Experian, tell me again, John. TransUnion, Equifax, right? I don't know why I can't remember those three things. But each one of them is required under law to give you a free credit report every year. So literally every 4 months, if you think about it, you can call Transworld, you can call Experian 4 months later. Just keep checking periodically. You can get that through annualcreditreport.com. That'll have the links to the three. And that way you can make sure no one's messing with your credit. So anyway, we'd love to help if you have any issues with Social Security, Medicare, any fraud-related issues, or any issues at all. Or you just want to express your opinion on all the things that are going on in the world. Don't hesitate to give us a call or go on our website for assistance. I'm really delighted to be with all of you today. And we got some time, so anybody who has any questions on these or any other thing, feel free. And I think, is it the lovely, is it Morgan? Megan? Morgan. No, is that? That's Megan. Yeah, don't confuse me. There's Morgan, but there's also Morgan and Megan. So that's Megan has a microphone so that everyone will be able to hear the question. I think there's a question in the back there, Megan. And I think my microphone is now playing games.
Test, okay.
Joe, first of all,
tell a little bit with the, scam thing. I was a victim of that, like your mother. I almost had to pay out, but I caught it. Now does it work better?
Yes,
Yeah.
yes.
Okay.
I don't know if mine's working.
PayPal is another company that will write you and say, somebody put a card for $800. And if you don't like it, call this number. When you call, that's the scam company. So when I, like that, I probably shouldn't respond. I do respond, I have to say. Let's get another, find something to do. Okay, so now the other thing I was gonna address is this. Because I am on fast democracy on my internet, I get current bill information. Now, there was a, can you hear me?
I can't, you were cutting out.
Was just authorized on August 12th. And it's HR 4968. It's called practicing, I guess, I can't. Social Security. On Speaker Johnson's desk. I fear that once it goes to Johnson's desk, does he suck up then to Trump or what?
Well, I don't know if mine's working now. So I didn't hear exactly, we'll find out. Has the bill passed already, you're saying? Did you say the bill had already passed?
He said it's on Johnson's desk.
Well, nothing ends up on Johnson's desk. I mean, the way it works is if it's been passed by the House, it goes to the Senate. And if the Senate passes it, or if the Senate has already passed it, it then goes to the president for signature. So Johnson doesn't have, now he may stop it from getting on the floor for a vote. And that may be, but here's the truth. Mike Johnson, who was actually my next door neighbor, we have offices that are next to each other in the Cannon House Office Building. And so I know him a little bit. We used to walk to the chambers together occasionally before he was speaker, and I've interacted with him several times as speaker. But truth is, Mike, if you were to meet him, you'd say he's a lovely guy, and he is. But he's a wholly owned subsidiary. There's probably not been a Speaker of the House of Representatives in the modern era who is so lacking in independence from the president. But usually what happens, because politicians are strange people, they're not like you. But actually I say that in jest, they're actually just like you. So in organizations, there's always rules, written and unruled, written in organizations when people get together. But what's always happened is the House of Representatives and the Senate typically have a great deal of independence because they don't rely on the president. They're elected independently. And so throughout history, it's usually been the case that presidents are frustrated with members of the House or certainly the Speaker or the Senate Majority Leader because they'll say to the president, sorry, we're not going to do that. And that's the end of it. Mike Johnson's the first person who's not like that. I mean, they will do anything the president asks them to do. Anything. I've slept in my office once in the last year, and that was because several months ago when they were passing the big bill, they couldn't get a procedural vote done. And the vote started, I think, 3 p.m. So I went and voted in the chamber, and then that was the last vote of the day. We were waiting and waiting. Oh, we had this vote, and then we were supposed to come back. And we waited and waited for several hours, and I said, I'll go back to my office. Everybody went back to their office. Chambers were empty. And 12 hours later, Mike Johnson, because he gave the phone to President Trump, who called the last member who was holding out, and they got him to switch 12 hours later. And I woke up 3, 4 in the morning, and I had to go back to the chambers to vote again. But whatever it is, all he requires is a call from the president, and they'll do whatever. They're literally a subsidiary now. And it's really terribly unfortunate because, look, I love Joe Biden as a person. I don't like the way his presidency ended. But we would never have given carte blanche to Joe Biden, to Barack Obama, to Bill Clinton, to anybody. I mean, we're independent, and we represent you. And so we're your direct representative. The House of Representatives is the only continuously elected body from the beginning of the republic that's directly elected by people, the only ones. The Senate is now, but for a long time, they were elected by state legislatures, and the president is elected through the Electoral College, which is representative of the will of all the states, but not directly elected, which I think is a mistake, but, anyway, I think, Mike Johnson will continue to do whatever Donald Trump wants to, unfortunately. Is that,
Yeah, he's got a.
Tony's on the case. You wanna try shouting it out?
The Texas Republicans are about to gerrymander 5 districts. Gavin Newsom in California is about to call their bluff. Will New York State do the same thing? Will we be able to do tit for tat?
You know, it's a great question. Did everybody hear the question?
Yes.
So this is about redistricting. So under the United States Constitution, once every decade, you're required by law to take a census. So we want to know where everybody lives, and we want to know who's here and how many people there are. Part of the reason for that is because the House of Representatives is apportioned based on the population of the various states. So New York's apportionment of members of the House, thank you very much. New York's apportionment of the 435 members of the House is a result of New York's population vis-a-vis the rest of the country. So New York has 26 members of the House. Used to have many more, but that represents roughly 5% of the population, because we're roughly 5%. And don't hold me exactly the percentages, but it's around there. So we do that. At the beginning of every decade, every state is counted, every state is given their number. Here's the number of members of the House you have, here's the number of members of the House you have. And then the states, the state legislatures and the governors draw the maps within their state. So New York has 26 districts. So the state legislature in New York and the governor make a decision on how to apportion those 26 districts. What's Joe Morelle's district gonna be? Or what's the 25th congressional district gonna look like? So years ago, I'm sorry for the long answer, but this will give you a perspective. So years ago in New York, we decided to take the decision of how the lines would look and how the districts would look and put them in the hands of an independent commission. We said to them, they're made of Democrats and Republicans and independents. You come up with the lines, give that to the state legislature, and they'll verify or they'll ratify those decisions. So that's how New York does it. That's kind of how California does it. So a lot of the reform-minded states started doing this. And in New York, we went even further. We said, you may not redraw those lines anytime in the middle of a decade. You've got to wait until the end of the decade. That's in the state constitution. A couple of months ago, Donald Trump, who I think fears losing the House of Representatives in the next election, for a lot of the reasons I talked about, called Greg Abbott, who's the governor of Texas. And he said, Governor, you should change the lines in Texas, because I think I could get 5 more Republicans elected if you draw the lines and cut out the Democratic districts. So in Texas, that's what they're doing. They called, the governor said, okay, Mr. President, I'll do whatever you want. So he called the Texas legislature back in a special session in the middle of the decade, because they don't have a constitutional prohibition. And they don't draw their lines with an independent commission, like New York does, like New Jersey does, like California does. So he said the Republicans are entitled to draw the lines however we want, and we're gonna draw them so. So I have 5 colleagues who are probably gonna be out of jobs. They were just elected, and they're not gonna be able to survive. So the governor of California, Gavin Newsom, said, well, I'm sorry, Mr. President, if you're gonna do that, then in California, where we have independent districting, we're gonna pass a change in our rules, and they have something called referendum. So every year you can put questions up for the public. But it basically says, in any year in which another state changes its lines, California can change its lines as well. So he's sort of trying to match what Texas is doing. It's a lot harder in California. I don't know if he'll succeed, but he's working at it. Now, brings us to New York. Because Governor Hochul has said, well, this is outrageous. We have an individual, Hakeem Jeffries, who would be Speaker of the House of Representatives and have enormous power and be able to do great things for New York, and you're trying to take the election away from him before a vote's even been counted. So, but New York's problem is several-fold. One, we have a state constitution that prohibits redrawing lines in the middle of a decade unless a court orders us to. And we have an independent redistricting commission that might not draw lines any more partisan than they did last time they drew lines. But I will say this, 2 years ago, we did do mid-decade redistricting because we went to court and said the independent district didn't do its job properly. And the court said, you're right, they didn't follow the rules. So the legislature did it, but we still maintained the standards of trying to be nonpartisan. I'll just tell you a side story. So, because this is how politics can work. I got a call 3 years ago from a colleague of mine, a Democrat. And he said, we should draw the lines to cut Monroe County into 4 pieces. And if we do that, we can attach part to Syracuse, part to Buffalo, part to Corning, and we'd have 4 Democratic seats. And I said, well, I'm not gonna support that. And he said, why? You'll have a safe Democratic district. I said, I'm not interested in a safe Democratic district. I mean, I like my job, I'd like to keep doing it. But Monroe County is one community. We're all together, through thick and thin, whatever it is, this is one community. So he said, but we could win more seats. I said, it doesn't matter whether we win more seats. This is a community. It shouldn't be cut up. So in the end of the day, he tried to get it done, but I was more successful in persuading people that Monroe County was a community. So, but we are facing struggles because it's not only Texas. In Ohio, they're now going back to redraw lines. In Missouri, they're gonna redraw a line to remove a wonderful, wonderful member of the House. His name is Emmanuel Cleaver. He's a moral voice in the district and in the country. They're gonna undo his line so he can't win re-election. A friend of mine in Indiana, they're gonna cut his district in half so he can't win. So they're literally redrawing. It's kind of like, well, we don't like the way this is gonna turn out, so we're gonna change all the rules. It's really, really difficult, but I'm working with the governor to try to restore some sanity here and to push back. It's hard, but I think we're committed to saying, hey, look, if other states are gonna do this, even though we believe in these reforms and we believe in nonpartisan districting, but it can't be just done in some places and not others, because then frankly, you're kind of fighting with your one hand tied behind your back, and that's, so we're working on it. Thank you for the question, big deal. There was a big rally on East Avenue and Winton Road this past Saturday. So I thank everybody who was out there. I got to go out and visit with people and honk horns and stuff like that, but we just have to keep pushing back. So Megan, is the microphone fixed?
Yes.
Okay.
Yes, it is.
Megan's choosing who had, yeah,
A hand up here. So,
coming this way.
hello. Sir, did you have a question? You have a question?
I do, actually. Thank you. I promise you, I am not a plant.
Okay.
So, with regards to Medicaid, I think you had said that 50% or something, a portion of the Medicaid is always paid by the states.
Correct. It's a state federal program. So the what happens is the bill gets submitted and then the state pays the bill and then the federal government reimburses the state.
Okay, so when you mentioned Medicaid's getting cut, does that transfer then more responsibility to the state?
Well, it's actually going to do 2 things. One, and they're doing it in a way where rather than changing how they pay, but yes, there's going to be some more responsibility in the state, but they're simply going to basically throw people off Medicaid. So no one will pay, it won't be the state. But the state has some responsibility under the state constitution for the well-being of New Yorkers, with or without the federal program. But it's basically gonna take people who are Medicaid eligible right now and discontinue their Medicaid eligibility. That's a lot of it. They're also going to do some other things to make it, put more of a burden on the state, to the tune of tens of billions of dollars. So I've spoken to the governor and her Medicaid team about that as well, but yes.
Ultimately though, is it the final decision of the state or the federal government if someone gets kicked off of Medicaid?
The federal government, there'll be federal eligibility rules. So for instance, under Medicaid right now, the only criteria on whether you're Medicaid eligible is whether or not make a certain income. So if you're below a certain income, you're on Medicaid. There are other things, if you're disabled, there are certain other things that can qualify you for Medicaid. So what the president wanted to do is say, not only to get Medicaid, you have to be poor, you also have to work for a minimal number of hours per month. So that's a new work requirement. So people who are unable to meet that requirement, they'll be thrown off Medicaid.
Okay, well, I guess another question is in terms of funding Medicaid in the state of New York. I'm not trying to get myself in hot water here, I promise. But, there's 670,000 illegal immigrants in the state of New York that are getting health care and are getting some support. I've got it right. They get emergency services, but in New York City, there's also a program that provides it to people that need it as well as children, and that's cool. And also,
But no Medicaid,
there's so many homeless too, right? No, I understand no Medicaid.
Yeah,
So, and there's, I don't know, 158,000 homeless, something like that. So couldn't those funds that are dedicated to the illegal immigrants be transferred over to the homeless and the people that, really need it? The homeless and New Yorkers, if there's gonna be a budget shortfall on Medicaid.
Well, I think when it comes to people who are undocumented, and many of them are seeking asylum, the state constitution requires certain things of the federal government for people who are in New York, and I don't think and I'd have to go back and talk to my friends in the state legislature, but they have some requirements. They do not use Medicaid, so I don't want people to say, we gotta stop giving Medicaid to people who are not documented or illegal. It doesn't you can't be on Medicaid, so they're not part of it. So I think the state is working through how to provide support for homeless right now. Many homeless people are on Medicaid if they go see a doctor, but the people who are homeless often have addiction issues, have mental health issues, so they're not really connected to any systems. And I think the state is trying to get them into services. It's really hard, but they're working on it. But I think the number of people, even if you discontinued all support for people who are undocumented, they're still here. So they're still going to go to emergency rooms, and as they say, doctors and hospitals still have to treat them. So then we'll all end up paying anyway. But I think the state's looking through and trying to figure out now. It is interesting that I think the federal government, I think what Trump did in the bill is said, even if the state's using just state money, no federal money at all for programs, if you help people who are not documented, we'll cut further funding. So they're going to get hurt even further. The states will with their state money. So if the state of New York decides we want to do this legally, we want to do this, they're going to be penalized financially anyway. So they're going to have to work through it. But that's a state decision.
Hi, Joe.
Yeah. How are you, sweetheart?
Okay. This sort of relates to the undocumented, which I prefer rather than illegal alien or whatever it is. And also the census thing. There has been some information coming out of the White House recently about ignoring the districting that's been done and also the law regarding how often we can have a census and doing a new census.
Yeah.
Do you have any take on how you think that's gonna
So
happen?
yeah, you guys have great questions. They're all complicated. So it's a really great question. Part of this dates back to both the founding of the country and then something that happened just after the Civil War. So the census requirement goes back to the original Constitution. But you'll remember that certain people weren't considered whole people when they considered the census. Those were enslaved Americans. Enslaved people were counted as 3/5. Remember that? So then the Civil War happens, and post-Civil War, we passed the 14th Amendment, which among other things has equal protection under the law, but the 14th Amendment also stated that we would have, thank you, I feel like a camel. The 14th Amendment not only stated that we had equal protection under law, but it stated that any persons born in the United States are citizens. So it no longer mattered who your mother was, your father, where they came from. It just said if you were born in the United States. So even if you're here, if your mother and father are here on green cards and aren't citizens but are here legally, or even if they're here and they're not documented, even if they cross the border illegally, if they have a baby while they're here, that baby's a US citizen. And that's been tested in the courts over and over again. The census, which is required every 10 years, the framers said they're gonna count persons. They didn't say citizens, they said persons. So one of the features of the census is it counts everybody who's in a state and everybody who's in the country, whether it's citizen or not. And it's interesting because the framers used citizenship in certain places very intentionally, in other places they did not. And here they did not. So I think what President Trump is now wanting to do is he says we should not allow the census to count non-citizens. But that's what the Constitution says. So he'd have to violate the Constitution or change it to get only a census of US citizens. And the reason he says he wants to do it is because he wants to help win the House back. That's why he's doing the redistricting, that's why he's doing this. Today he's announcing that he wants to put an end to voting machines. I don't believe, but he wants everything on watermark paper. So people would have to hand count ballots. But be that as it may, the census, midterm census, it's not prohibited under the Constitution, but it is prohibited that you can't limit it to just US citizens. But you wouldn't be able, I mean, doing a census is really hard. There's 340 million people that need to be counted, and a lot of people don't like answering census calls. We have to beg people to answer the census. New York lost a congressional representative this last decade because of 88 people that went uncounted. And I'm sure thousands went uncounted, but because of 88, we lost a seat. Minnesota would have lost it instead. But so it's all part of the stuff about, illegal immigrants. And here's the funny thing, and not funny, but funny ironic. So this will shock you. The Morelle family was not on the Mayflower. I don't know how we missed it. But we were not on the Mayflower. But my great-grandparents came here roughly 1901, 1902. And so my four grandparents were all born in the United States. But, when my great-grandparents came, and I've seen the ship manifest, they had roughly $20 in their pocket. They didn't have a communicable disease. And they probably had a cousin somewhere that could get them a place to live and a job. But you could get citizenship pretty quickly in America in those. In fact, in the early 20th century, people came primarily from Europe, but came from all over and became citizens. And the population of the United States dramatically increased in the early 20th century, largely on the backs of new Americans. But today, so some people will say to me, well, people can just become citizens like our grandparents and great-grandparents did. It probably takes a decade now. If you do everything right, it'll probably take you 10 years to be a citizen. It's not like the old days. They changed the law in the 20s and 30s. That's all gone away. It takes forever to become a US citizen. So honestly, I say this to people, and I would support border security. I believe in borders. You need to make sure that people coming in aren't going to do bad things when they come here. So I'm all for that. But I'm also for this. I also know this, that if my children if I was being hunted down and my children couldn't eat, they had no place to live, I would do anything to take care of my kids. Same thing with my grandkids. You would all do the same. There's nothing you wouldn't do for your children. So frankly, if it's crossing over some border to get into the United States and then figure it out from there, you're going to do it. So what we really should have is a rational immigration policy that makes it easier for people to come here who want to become citizens of the United States and make sure that we have border security. We can do both. And people make it sound like we have to pick either from column A or column B. It's absurd. We can have border security. We can put a lot more guards at the border. We can do a lot of things here, but also make it easier for people to come here. And I find this remarkable. People don't line up to get into Russia or to break into North Korea or to break into Iran or to break into China. They don't do it. They do line up to come into the United States because this is the greatest country in the history of the world. I really believe that. And, you know, the fact that they come even when they know they're not wanted now is really pretty extraordinary. So we've got to figure this out. And by the way, we're chasing out, you know, the president said, and I don't want to get on my high horse and I want to be mindful of time, but the president said they're all rapists, murderers, and killers. So, and they don't work, and they're all living off the rest of us. But it's funny, they're going to workplaces now to find them. These are people who are working, they're paying taxes. And, you know, I had recently some work done by a local landscaping company, two gentlemen from Mexico, a father son, actually. I'm not gonna lie. They said you gotta have your cars out of the driveway by 7 a.m. They were there at 6:45 every morning, and they worked through, and when I say they took a break, they took about a 20-minute break to sit in the garage and eat their sandwiches, then went right back to work. These people work like dogs. Now, I didn't ask them what their status was. It was a little before all this mishigash about who everybody is. But I tell you, they worked hard. I think every successive generation in America works a little less hard than the one before them. Those first generation Americans worked really, really, really hard. So look, you're gonna see food prices are gonna go up because people don't wanna pick. You know, America, I'm sorry, my grandkids, I love them. I'm not sure they're spending long hours out in the hot sun picking apples. So, you know, and they're going into, and a lot of business owners are now getting really alarmed at the raids that are being done at people's places of business. So I just think, let's figure it out. I know it's easy to make it a political issue, because people win elections thundering against, you know, illegal people, but this is too important, and we need workers. We really need workers. And honestly, some really smart people too, who want to leave China, who want to leave other places and come work here. My friend, who was the head of the National Science Foundation, used to say, Joe, just think about it. We get the benefit of the really smart people, and those countries that they're leaving, they don't get the benefit. It's a twofer. Makes so much sense. Anyway, okay. Other questions?
Excuse me, exactly how does this redistricting affect the general election? I guess I'm not quite clear on that.
So next year, when there's when there's an election for the House of Representatives, that's the only one it affects. It doesn't affect the Senate because that's the whole state. So if you think about it, my district is all of Monroe County and a little bit of Ontario, East Bloomfield and Victor. It's 770,000 people. So if you really wanted to get crazy with it, you could take a quarter of the city of Rochester and put it with Wayne County, and you could just cut it up so that instead of a Democrat representing Monroe County, you draw it specifically so it's almost impossible for a Democrat to win. So that's what they're doing in Texas. They're taking 5 seats currently held by Democrats, and they cut them up into pieces, and they add them to existing Republican districts and create 5 new Republican districts. So at election time next year, instead of going and voting in the districts that you might have voted for 2 years ago, you'll be voting in a new district that, you know, in the past may have been marginal, may have been, small advantage for a Democrat or Republican, is now much more Republican. And what the way they do it is they take a district, now we're really getting in the weeds, but let's say it's a district where the Republican wins routinely 70 to 30. It's a heavily Republican district. So they take parts of the Democratic district and put it into the Republican district. So now the Republican, instead of winning 70-30 by 40 points, wins by 30 points. So they can absorb some of the Democrats, and they take part of the Republican area and push it up, and they just redo them so that only Republicans can win. That's the president said, we're entitled to win 5 more Republican seats in Texas.
On a ballot for the general election, you pick your man you want to win. Does it matter what district he's in?
Well, it's not about the candidates. It's about what the district, the number of people who live in the district whether more of them are Democrats or Republicans. So if you have, like my district is 770,000 people. You could take 50,000, 60,000 of those people and no longer put them in my district. You could put them in Wayne County. So they would then be in a different district, so those same people.
Still don't understand what that has to do with the general election. When we go to the polls, to vote for the president of the United States, how does that districting affect that?
No, it won't affect the president.
That's what I'm talking
No, it won't affect the president. It won't affect the U.S. Senate. The only thing it'll affect is the U.S. House of Representatives. And the president is worried because all the polling shows that if things were left as they are right now, it's not likely that the House of Representatives would remain in Republican hands. That's what he's doing. He's trying to affect that by rewriting those rules.
I was thinking of just the general election.
No, you're thinking of the presidential versus, yes, I'm sorry. Yeah, gotcha. Thank you. Does that clarify it for you?
Does that affect the presidential election?
No, because that's all statewide. So statewide, that won't, the lines within the state don't affect the whole state. No.
So what do you think it is that Trump says to these Republicans to make them cave?
You know, it's a really good question. It's really, it's.
What's he say behind the door in that phone?
Yeah, I think it goes like this, honestly. Because I have a lot of friends in Washington who are Republicans who really don't like Donald Trump, and they know what's happening to America, and they don't like it. But this is what he'll say. He'll get them in the Oval Office, and he'll say, so Joe, I want you to vote for this bill. Gee, Mr. President, I have real concerns about I represent a district that relies on Medicaid or whatever the issue is. Well, I'd really like to see you stay in Congress. And you say, well, I'd like being in Congress. They're like, well, but I think if you don't vote for this bill, I'm gonna find another candidate and I'm gonna raise a lot of money and I'm gonna come campaign against you. And you're not gonna, even if you leave the Congress, you're not gonna get a job lobbying or doing anything. And you can forget about your family members running for office. I mean, I think it gets like that. So, I think he plays the game, if you will, it's a terrible way to phrase it, differently than any president ever has. It's much more, and it's more about him. I think that's the problem, but anyway.
What do you suggest that those of us who are very concerned about our democracy, what do you suggest that we should be doing now to help create a change?
So I think it's a great question. I get it a lot. You know, when I'm at Wegmans, when I'm at the dry cleaners. It's amazing how recognizable apparently I am, even with a baseball hat on. I don't know what it is. So I think there are several things people can do because I mean this sincerely. The most important title in a democracy isn't president, it's not congressman, it's citizen. Citizens have to make themselves be heard. And it's an extraordinary thing we do in America where citizens are in charge, but they got to take charge. And I think there's ways to do this. First, get involved and go to protests, go write. I mean, I think, you know, what happened on Saturday was like where I was, it was really great to see people, they're frustrated, they're angry, but they're giving voice. And under the great Bill of Rights, under the First Amendment, people have the right to assemble. They have the right to seek grievance from their government. They have the right to speak out and express themselves, and they're doing that, and I think people ought to continue to do that. Second thing they should do is people should become more active in whatever way that means. Doesn't necessarily mean in politics, although that's one way, but it means in organizations where you're talking to people and seeing people and sharing and trying to have some agency for what you do. So I encourage people to do that. The other thing, I pulled together the other day the county executive, who's a longtime friend, the mayor, the heads of the two healthcare systems, the head of Food Link, and the people who work for them. And I said, look, there's going to be in a couple of years, so it's going to start sooner for people who have SNAP benefits, which is what we used to call food stamps, because those are going away too, a lot of them. That I think we ought to, as a community, come together and figure out how to make sure every single person on Medicaid meets all the requirements for filling out paperwork, doing all the bureaucratic hurdles that are now gonna be placed in front of them. Let's take that on as our collective community responsibility, make sure no one is left behind. That's funny, isn't that what George Bush is saying? No one left behind. And so we're starting to organize volunteers. We're gonna get people to make sure that every single, I wanna have, of the 435 districts in the United States, I wanna have the one with the least people thrown off of Medicaid in the country. But it will take an enormous effort, so there's gonna be volunteer opportunities. And I also say this, I think it's important for people to get involved in politics, whether you're a Republican or a Democrat, get involved in campaigns. I feel sometimes so strongly that we have done this huge disservice in this country because I think a lot of people don't know the first thing about civics. And I think most people, if you ask what are the branches of government, I think they'd struggle to answer it. And that's on all of us. And look, no one should know as much about this as I do. I mean, truthfully, like there's a lot of, I mean, this is what I do. This is my life. I spend all manner of day and night reading, talking to people. This is my job, but it's also my passion. But everybody should have a working knowledge of it. And here's the other thing that we've got to get young people to think critically. Just don't take things at face value and just accept. I mean, what's fascinating about this world, I'm sorry to go off on this, but I'm just going to use this moment. What's fascinating about this world is when you think back when we were younger, you got information in a handful of ways. You watch Walter Cronkite or Huntley and Brinkley, you read the daily newspaper, which here we had 2 different daily newspapers. You could find it in other ways, but there was, and we all watched kind of the same thing, but they weren't trying to persuade us of anything. They were trying to report to us what was going on in the world. And then it was on us to make whatever judgment about that we thought. If you think about the Vietnam War, you saw the Vietnam War happening. People started by supporting the government. Ultimately, probably the vast majority of Americans no longer supported the government. But we got the information through a media. It wasn't trying to convince us of anything. That was for us to decide, to think about what we thought was proper to do for our government, for our people. Nowadays, people don't get information without its bias already attached to it. So, I'll watch Fox News. It's really hard for me. And I probably can only, I could stay underwater longer than I can watch Fox News. I try. But what I resent to some degree also, and I'm on MSNBC. I mean, they ask me, I go in the morning. And they have a program called Way Too Early, which you have to get up at 4 in the morning, which is way too early. So I tell the host she appropriately named the show. But even for MSNBC, and to some degree, you have all of them, like they're telling you what to believe as they're telling you about it. I really don't need, no disrespect because he's a friend, I don't need Chris Cuomo telling me what's happening. Just tell me what happened. I'll figure out whether I think it's right or wrong. And I think we have a generation of Americans who are now this is what they've learned, is that I don't like that, so I'm not going to pay any attention. I'm not going to even acknowledge it exists because I'm going to keep getting information from the people who I already agree with. And I tell you, it is really bad for us because we have complicated issues that face the world. And if you can't think about it and come to your own conclusion, you're going to be influenced. I mean, everybody's influenced, right? I'm influenced. I'm not even saying this in a joking manner. I'm influenced by my wife. I'm influenced by my kids. I'm influenced by my grandkids. I hope I'm influencing them. We all influence one another. That's not the issue. The issue is, can I take this set of facts? First of all, when someone says something to me that's crazy, like remember I said there's a guy who represents California district, 67 people of the people he represents are on Medicaid. I honestly, when I heard that statistic, I said, come on, is that possible? So I looked at it, did research, and found out that it's actually true. But I hear a lot of things every day. People say, oh, this or that. And I'm like, I don't know. That doesn't comport with what my view of the world is or my experience is. Doesn't mean it's not right. But if it's something that I just think, that seems strange to me, I'll ask and start looking, is that true? Because if that's true, that changes to some degree how I think about the world. And I want to know that, because I also don't want to stick to my belief system when there's something that premised, if the premise is wrong. I just read a great book, any of you who are readers, called Think Again. It's by a psychologist. His name is Adam Grant. I'm going to write to and see if I can talk to him. But he made it really, one of the things that stuck with me in the book is he said, don't cling to your beliefs, cling to your values. But the things that you believe could be wrong. So rethink all, it was really interesting to me. And I think we should all do things that we're a little uncomfortable doing, things that are a little outside of our experience, because maybe it'll help us, you know? So I had this idea, this crazy idea, that I wanted to play the piano. Does anybody play the piano here? I want to see who I'm jealous of. Nobody plays the piano in the whole place. Wow. So anyway, I played the trombone when I was a kid, which, just to tell you a little bit about how my behavior is. So I was in third grade. I was probably about that tall. I didn't get much taller from third grade, but I was really small. So they come into the classroom one day and say, the school band has a problem. We don't have enough, and we need somebody to volunteer. And I think I put my hand up before I heard them say what it was, because that's how my mother would say, who would like to? And she'd say, Joel put his hand up. He said, play the trombone. I'm like, okay, I don't know what a trombone is. And it turns out it's got a really long slide. So I played it for like 8 years. But I really, you know, if you're at a party and you want to sort of like sing and play the piano for people, you don't pull out your trombone. Unless you're Glenn Miller. And I was not Glenn Miller. So, but you know, it's interesting. So I've had a couple lessons. I'm working on my chords and getting but it's interesting. It's something different that I've never done before. And I just sort of forcing myself to do things that I'm not comfortable doing, partly so we can keep thinking. So I think and you know what, we should use these moments to talk to people. So I don't know how I got way here from your question, but talking to people and trying to find common ground. Because this is what I do believe about the vast majority of Americans. We all want the same things. We want to grow up and have good jobs. We want our children to be safe and educated and have a good future. We want decent health for ourselves and our family, and we want to retire with dignity. Everybody agrees with that. I mean, I don't know. We want to be that. How we fight so much about how to get to those basic things is really kind of mystery to me. But I think people should become engaged. That's my short answer. So thanks for the question. I don't know. Did we lose Megan? Oh, there we go. Yes, sir.
I got a simple one. I was thinking, instead of using criteria for population, what if they define the districts geographically? Then you wouldn't have these fluctuations. Let's say Monroe County, Wayne County, Ontario County, and Yates County, something like that would be permanently, assigned this to your district. So we don't have to worry about population.
Well, the reason we don't do that way, there's a couple of reasons. First of all, that is how the Senate is devised. It's those geographies are the states. So Wyoming has a population of about 500,000 people, 500,000 roughly. They get a representative in Congress in Wyoming, and they get 2 U.S. senators. So they get 3 people in the Congress to represent them with 500,000 people. California has 50 plus million people. They get 50 some odd members of the House, but they only get 2 U.S. senators. So think about it. 250,000 people per senator in Wyoming. In California, 25 million people get 1 voice. So I think the reason we don't do it is because everybody in the House is roughly expected to represent the same number of people, so that every single American has the same voice as any other American, and the House is the only place where that happens. And so I represent 771,000, I forget what the hundreds, people. Every single member of the House in New York, whether it's Claudia Tenney, who represents the rural area, or Nick Langworthy, who represents the southern tier, their districts are physically much bigger, they still represent 771,000 people. So that's the theory and the philosophy behind it. That's what the framers went back and forth about this. That's why the Senate has two, every state gets two, and every state gets as many members of the House as is represented by the population. So that's how they sort of, and there's a lot of people actually think big states like California, Texas, New York ought to have a third senator, but you'd have to change the Constitution to do that. But that's why.
My question is, when I contact my legislator, because I have an opinion about something,
Yes.
what is the most effective way? Is it a phone call? Is it an email? Is it a handwritten letter? What makes the most impact?
Yeah, that's a great question. I wish I had a good answer for you. I think it depends. It's sort of, you know, a lot of people ask that question because they want to know. I have an opinion. How do I make sure that my opinion gets adequate weight? What do I do? So I don't know how other members do it. I know how we do it. I have a weekly report, which I get on Friday afternoon, of the number of people who contacted us. And they'll have, for instance, email, but we have two categories of emails. We have the program emails where someone will say, you know, fill out this form and send it to you. So it's an organized email from national groups, and that happens. We may get thousands in a week, 5,000 emails in a given week. And it'll tell me of that number, how many are for what the issues are, and then how many are for this issue or that issue. And then we'll get the number of emails that don't appear to be a part of any particular organized effort, just someone wrote me by email. Also get the number of letters and calls that we get and what the subjects are. And then also the number of cases that are opened. So if there's specific cases that we have, so toys area, veterans, immigration issues. So it kind of depends. And honestly, when I get 5,000-6,000 emails in a week, I'd be less than honest if I told you I read all 6,000 or 7,000. I said it wouldn't be possible. So the staff looks through them and they pick out those that they think are important either for me to see or to talk to me about. And then we prepare responses. But it's hard. I mean, I knock on doors, so I do events like this to talk to people, find out what's on their mind. I go out and knock on doors. But 770,000 people to represent, it's really hard. I know it's hard for people to even get it around their head. 750,000 people. If I talk to 100 people a day, I get to 700 in a week, which would be about, you know, 3,500, 35,000 in a year. It would take me 20 years at that pace to talk to everybody. So it's hard. I think emails that are not part of campaigns are effective. I think letters are effective. I do think phone calls. We have people who call in and give opinion. We keep track of all that. So I think and it depends on every single member may have a different way of doing it. This is how we do it. But I say reach out, contact us, call, write. If you write a letter or you write an email, that is probably more effective in the sense that we know someone took some time. They didn't just add their name to a petition that got, you know what I mean? So that's probably the most effective. And coming to events like this, honestly. Thank you. Yeah, I think we probably have time for, yeah, this gentleman is gonna get the last word. Well, I'll probably get the last word, but he's gonna get the last word before the last word.
There was an article in yesterday's Democrat Chronicle that said in the year 2033, based upon the current structure, Social Security benefits will be some 20% lower than they are now.
Yeah.
I have concern.
Yeah.
My children.
I think I think that was on, if you go back to Social Security, this is what I meant by, go back, John. One more, right there. So the budget is expected to cause a 24% cut to benefits by 2032. So what that means, and that's not to suggest that your benefits are gonna be cut by that much, but we take in enough money to fund the Social Security Trust Fund and pay benefits out. At some point in about 5 years, that we will not make enough income on our reserves and on taxes being paid in, and we would have to subsidize Social Security, and that's the problem. That's why this is so important, because we need more revenue to pay out the benefits. And when people stop paying that $176,100 and make $500,000 or make $1 million, then we're leaving a lot of resources on the table. So that's why I think the wealthiest Americans ought to pay more to make sure that the solvency of Social Security continues. They would also, by the way, because remember, your Social Security is dictated to by the amount of money you made over your lifetime and the number of years you paid in. There's a calculation. So people who would pay more, who make more, they would get more too, but it would be more than offset by their contributions to the system. So, but thank you for the question. Hey, thank you. This is the best Monday morning I've had in a long time. I worked out and I got to spend time with all of you. So again, feel free to reach out to us if you have any questions or if you have any need for service at our office. Thank you. God bless you. And thank you to Tony.
Thank you, Tony.
Well, thank you. Thanks for being here. Appreciate it. How are you, sir? How are you? Yeah, you look well. Yes. You look great. You ever talk to Vinny Esposito? I don't. I'll text him and say, tell him that I saw it. Thanks for the water. I think I needed it. I try to keep hydrated. Yeah. Well, thank you. Really? Yeah. Wow. Yes. Wow. That's crazy. Thank you so much. Thank you. All right, man.